Welcome to the InTouch Health webinar series. This is Rachel Gonzalez, and I'll be your host for this webinar. Today we're featuring Andre Grujovski, InTouch Health Vice President of Solutions and Product Marketing, and today he'll be presenting on our latest software update. Andre is the VP of Solution and Product Marketing at InTouch Health and has worked here since 2005, serving in a variety of roles, including account management, product management, marketing management, and marketing leadership. Andre received his BSE from the University of Michigan and his MBA from Pepperdine University. We'll begin our webinar shortly, but first a few housekeeping items. You all have been muted. If not, please make sure you mute yourself. At the bottom of your audience console are multiple application widgets you can use. If you have any technical difficulty, please click on the Help widget. It has a question mark icon and covers common technical issues. You can expand the slide area by clicking on the Maximize icon on the top right of the slide area or by dragging the bottom right corner of the slide area. During the webinar, you will be able to enter questions in the Q&A widget located on your console. Questions will be answered at the conclusion of the presentation, so feel free to ask your questions at any point throughout the webinar. If a fuller answer is needed or we run out of time, questions will be answered later via email. The webinar will be recorded and a copy will be available on our website and via email within 48 hours. This presentation should last about 60 minutes, including time for questions and answers. And now, without further ado, here is Andre.
Thanks, Rachel. So I wanted to first say thank you to everybody for joining today, and thanks for the opportunity for me to be able to present. This is the first time we're doing this as an organization in sort of a formal effort, and this will be an ongoing thing to provide more clarity and insights to our customer base. I wanted to just say, first and foremost, I'm here presenting this, but there's an army of people that have made this all possible today, from our engineers to our product managers and marketing team, and we're all here to support you and bring you great products and solutions. So the objectives of our program, our monthly software updates to our customers, is really to allow us to continue to showcase our full suite of solutions and capabilities that can help you scale your telehealth programs and give you some insights into what's available now and what's in the future, so you can continue to see our advancements. We know that you guys have a lot going on. You're trying to continue to grow your programs. You're always interested, and it's hard to sort of keep up to speed with what's happening. And here at InTouch, we've had a lot going on in the last year with different acquisitions and new product introductions. And we really want to let this be an opportunity for our customers to know what it is we're doing before it comes out and get some insights into it. So the communication program is consistent of a couple of things. Is this customer webinar, also a customer notification email that you should have all received, and then also incorporated with branded release notes. And so a lot of what you'll see today is sort of a recap of some of those release note content, along with a couple of videos that go in and show what some of those solutions look like in person. And in the future, we'll be adding in a highlight demo video that'll be more of a production-ready video that you'll be able to, it'll sort of walk you through and give you more insights. We attempted to accomplish a little bit of that today with this webinar, and I'll just sort of talk over that video as we go. And here's a couple of examples of what you should have been seeing or will start to be seeing. You can always sign up for our newsletters through our website. Make sure that you're receiving those. Here's you sort of see our software update newsletter. We send that out on a routine basis. What's new, then our release notes, which is a detailed look at the specific elements that are involved in each release, and then this customer webinar that we're doing right now. So let's get into a little bit of what we're going to be seeing today, how it's structured, how it's framed. I'm going to take just a couple of minutes to sort of set the landscape for how we think about things here in the marketing department, as far as how we roll out products and solutions to you, so that we're all on the same page. So first and foremost, we're thinking about how do our customers take our solutions and go implement that. And they do that through different use cases. And this slide represents a pictorial view of a patient journey sort of through the care continuum and the different areas of care that we've segmented out. And then broken down, you see each individual use case in the different blue, red, or teal, red, and blue buckets or boxes. So next to those that have a star next to them are ones that have significant updates involved in this monthly release. And so you'll see great additions to our direct-to-consumer, direct-to-patient offerings. Our stroke, critical care, behavioral health, and neonatology programs are getting added capabilities, and also our specialty follow-up for clinic-based interactions. And if we think about the landscape of our product set, and from a software perspective, our virtual care platform covers a lot of elements. Our operating system that allows for this connectivity and integration across your programs, our additional software modules that allow for things like documentation, access to imaging, analytics, intake and coordination of telehealth consultations, and then also our devices. And when you add on those devices, we are able to sort of create these whole solutions for you. And today, from a software rollout perspective, we'll be mainly focusing on those software modules you see on the right, which are intake, imaging, smart notes, coordinator, analytics. And then from a provider access perspective, we have both our provider access software, which is a thick client that you download to your desktop for those users that are familiar with that, and then our web provider app, which is our web-based portal that you can log into for connections. And so a lot of it's going to center around those two. So let me go in a little bit deeper here around provider access software. So right now today, we have our provider access software that it's sort of download maybe to a laptop or a desktop or to an iPad or an iPhone. And that allows you to connect to our telehealth devices, like the light that you see there. Common use cases for this are customers out there doing things like stroke, behavioral health, neonatology, critical care, cardiology, specialty follow-up. This system has been designed to allow this connection to a device and get all of the great controls and configurability of that device. Our other solution is our web provider app, and that is designed around these virtual waiting rooms. And it's really designed for use cases like direct-to-consumer, direct-to-patient, employer site. And that's where the provider is actually connecting into a web application through a web browser. They're doing that once the patient has entered into the virtual waiting room through a series of steps on their side, which is an intake process. And that patient is able to access that. What you'll see now, what you're going to start to glean is a merging of these two solutions, meaning we're going to be bringing more capabilities to our software that's downloaded onto through the thick client, and then more capabilities to that web provider app, and being able to merge those into one integrated experience. And we'll talk about that a little bit more at the end. So first, I wanted to just do a quick poll and ask which platform are you currently using at your institution, whether it's the provider access software or the web provider app. So if you could just take a minute to fill that out. And okay. And so it looks like most of the people we have on the call today are using the web provider app, but we're going to go ahead and go through and provide updates on both of them to give a nice, thorough update on all that we're doing. So we're going to start with the provider access software and talk about the modernization of our interface. So we've added and just as a level set, you'll see in the corner a little video icon here on many of the slides. That represents that this particular part that I'm going to talk about will be shown in a video later. So I'm going to talk about it in a slide, and then we'll see it in a video shortly. So we've modernized the interface of our provider access software, just giving it a nice new look, feel, and some updated control capabilities. We've improved our third-party single sign-on capabilities for things like being able to connect to Epic, and this gives our users access, be able to launch our applications from their applications. Also, we've improved our connectivity between our own applications to make it a much more seamless experience for our customers. We've brought in support for our new Light 4 solution, which will be shown in the video as well. We've also improved our multi-presence or multi-party connectivity capabilities with basically just abilities to do things like telestration, live cursor, and have more functionality around managing and sharing images. We've modernized our iOS apps for new UI and look and feel, taking advantage of some of the new capabilities that have rolled out in recent iOS the core operating system functionalities. We've also added in a nice capability that you'll see in the video around dual view documentation, to where we can now, not only can you document and pull up a screen like our Smart Notes, and also view the patient, which you've always been able to do, but now we've brought in the ability to also bring in an external video source alongside of those two things. This was particularly driven by our neonatology use case, where they needed to be able to see perhaps overhead, looking down into the baby's isolette, while simultaneously communicating with patient staff and documenting through calculators as well. Last thing you'll see is a new scoring survey that we can do. This is a standard survey that we have in place that really allows you to rate your experience that you've had during your interaction. And so you'll see that shown as well in the video. So this is the video that we're running. Here you can start to see the modernization of our interface. We've added in new activity auto logout times and scaled that modernization across all of our different settings. Now we're going to go ahead and log in and show the Light 4. Here I'm logging into a Light 4 that we have in our demo unit, in our Innovation Center that all of you have access to. You'll see there the new notifications that pop up that are now outside of the screen. I can dismiss those by clicking them. Down here is a thermal camera. Oh, wait, that's not yet available. We'll be talking about that in the future. And here you can just see the nice, great views that you have, still our abilities to do all that you're used to as far as box zoom, get in close, leverage those HD cameras that are on there, and all of the capabilities that you're used to. So that's our quick showing of the Light 4. Next, we're going to go in. Here's our survey, and what the survey looks like when it shows up afterwards. I can rate that and submit my results. Now I'm going to connect into a Light that I have set up with an external video camera to show you a little bit about our dual view capabilities, where I can show documentation alongside of an external video source. So similarly, I'm in a Light. I can open up something like my Smart Notes application and find the patient that I might want to be consulting on, and then now I can go down to the bottom. I can open up my auxiliary video, and for my second, I can select a different input. And here you can see it's perhaps pulling in an ultrasound feed that I want to be able to see, and so now I could see all of those inputs while I'm still able to access patient documentation. And then, should be it. Okay, so that's our update video on our provider access software. And now we're going to talk about our web provider app. Again, this is our web-based solution that allows, set up with virtual waiting rooms, really used mostly today for things like direct-to-consumer, direct-to-patient use cases. So we have improved both our InTouch patient app and our InTouch provider app. I won't read through all of them. These are in the release notes as well. Some of the key updates around language localization, ability to add single sign-on support, etc. One of the nice features that that we've enhanced around our virtual waiting rooms is our ability to now bring in something called what we call a care location, and you'll see the video of this as well. But I'll take a moment here to describe it. these virtual waiting rooms, we've seen a big need for our customers to want to be able to have a location. So right now, today, a patient can use their device and go through an intake process, end up in a virtual waiting room. But our customers want to have static locations where they can go up, have a screen. A patient might click on that, say, "Yep, I have an appointment. I want to go and connect in and walk through." Maybe it's at a kiosk or some sort of setup where it's a clinic, and they can walk through and have a dedicated location device that is allowing them to walk through this process. And so now with this care location concept, we can actually put these virtual waiting rooms into those types of locations where you can initiate a consult. And in the video, you'll see how we merge that between, you can have an online visit and an in-person visit through this type of a kiosk setup, and it all sort of melds together into one workflow. And that's sort of coupled with this concept of now allowing multiple patient journeys. So in the past, a patient journey is really just a way for us to configure how a waiting room is going to walk through a series of steps. So on the left here, these are the same waiting room, but I have two different journeys. So my first journey, I walk through, I get authorization from the patient, I let them schedule their consult, and then they're done. So imagine they go onto a website, they're able to schedule in advance, then they show up to that actual location that has a care location attached to it, perhaps it's a kiosk. They authorize themselves, and then they complete the process. They do their payment processing, maybe consent forms, questionnaires, and then do their telehealth video when they're ready. So this is our way of being able to create more flexibility and control, and really bridge the gap between how consumers and patients want to interact with our customers. Another great capability that we've added is language localization. So we actually did a lot of work for foundational work and within our platform to allow for this. We did a great project with Albert Einstein in Sao Paulo, Brazil, and through that we've developed Portuguese and now, but also the foundational elements to be able to build out language localization for our international customers. Two other capabilities that we have is provider-to-provider calling. So now from directly within the application, I can connect to another provider, somebody who's in my list. I show that briefly. And then also improved reporting capabilities. You can now download into a CSV format for a given data range, all of the data elements from all of the utilization elements for your program, data elements from your program, sorry. And then also you can generate a visit summary PDF from a particular patient if you want to generate that on the fly. I show the provider-to-provider calling, and the improved reporting capabilities are pretty straightforward. We've also improved the patient profile, which I show in the video, improved some of the navigation, added a health system patient ID that you'll see for better linking with the EMR records. And then we've also modified and updated some of our patient intake process experience. So now patients are able to authorize themselves through an SMS message. The patient email invite now displays the payment amount if that's a part of your program. Also approval pages with the payment information can be displayed, and a patient can complete the intake from the screen of a device like we were talking about before. So and then also improve patient scheduling, more options, better visibility and displays on the screen as far as self-scheduling goes, as we're seeing more and more use cases take on those requirements. So here's a video where I'm showing the virtual waiting room configuration. This is where our customers set up their programs for like direct-to-consumer, direct-to-patient use cases. Here I'm going to go in and show what the care location setup looks like. If I go into my practice administration and practice settings, you can see I can now check out my care locations. I've created one called Andre Care Location. This is actually a viewpoint. This is actually connected to a device that's running our viewpoint software on it. So not only can I leverage it for some sort of a check-in process, I can also connect directly to that device from within this application, which I'll show you later. Here, now I'm starting the first step of this patient journey online. As myself, I'm going to log in. I'm going to come into this website. I'm going to put in my email address. I'm going to get my passcode. And basically what I want to do is I want to schedule a visit for later, right? I'm going to put in my information. Here I'm just sort of verifying who I am. And I'm going to select a time that I want to do that consultation. Maybe I'm going to put in my phone number so I can get an SMS text reminder for that. And now I'm really ready to go. So this screen is done. I've completed that process. And now later I'm going to show up to this care location, right? Here perhaps I've called it cardiology. This frame you see here is going to be running on the device, and I can select my service. Now this is at some point later. I'm going to come back in and verify myself in this example. And I'm going to verify through two-step authentication with my passcode. I'm going to grab that passcode. And then I'm going to see on the screen that, here's the time that I had scheduled myself, right, for 12:30. I'm going to come back in. I'm going to proceed through. I'm going to do all the things as far as consenting for myself, telling why I'm here, all the things that you're familiar with today, so you can see the full range of capabilities of the intake process. Sort of that I've had this problem for just the last day. It's not too bad. It's kind of dull, but it won't go away, and it's constant. And now I'm ready for my consult, right? Just like we see, that alert goes back over, and you'll see that the patient's ready in the queue. So those new capabilities really open up the door and expand a lot for us. I'm not going to actually go in and connect right now, but I am going to show you the improved layout on the patient demographics. If I go in the patient profile, now I can add in phone numbers. You can see the language. You see the little American flag there. I can have multiple phone numbers now. If it's my work or my mobile, whatever I want, I can add that. And as I mentioned before, now we have a location for the health system ID that can be added in to link for the EMR more easily. And then at the bottom, you can see actually patients can be marked as active or inactive in this view as well. The other two things I wanted to show were the provider-to-provider calling. So now I can just go ahead, find somebody in my network or my address book, and go ahead and connect to them. Here, Vince, when I tried to connect to him, he wasn't actually online, so we didn't successfully make that connection. But you can see that I could do that. And then now I can actually connect to a location. So here, what we're starting to see is a merging of our provider access software and our web-based software. From within that virtual waiting room, I was actually able to connect right over to this Vichy device and take full control of it, just as I would if I wanted to connect in and see a patient perhaps in my cardiology clinic. And so that's where we're starting. That's where we're really moving toward, is this integrated experience between both of our solutions. And I think that this diagram starts to really shape that for us as far as what does that mean. The provider is now really now has lots of more options of entry points, right? Connecting into their devices, other hosted devices, kiosks, right to patients. And these virtual waiting rooms allow us to facilitate that flow of providing and alerting our providers when the patients are ready, when they want to make that connection. And that's really what's driving us toward this integrated experience, where you'll see more and more capabilities for our providers to be able to access things through web browsers, create more flexibility and configurability for them as we move forward. And we're really excited about what's coming with that in the future. And through these monthly webinars, we'll be giving you more and more insights into how that's developing and how it's progressing. Here's another example of that integrated experience. So you can see here, I'm actually logged into the provider access software. I'm connected into a device, but I can simultaneously see my virtual waiting rooms, right? So I can now pull in my virtual waiting rooms, see my patient load, see my patients that are sort of in queue across all of my virtual waiting rooms, access their information, their past notes, etc., all from this one experience. So we're really melding these things together so that we can bring devices to those solutions like direct-to-consumer, direct-to-patient, or other use cases. Also bring the virtual waiting rooms over to the solutions like stroke, behavioral health, critical care, cardiology, and really provide the benefits that both of them provide. And so the next thing I want to do before we wrap up is share with you a little bit about our roadmap. So this is for Q4, so we're already into the fourth quarter of the year. And so some of these things I've already just shown you, but I also want to give you a little bit of insight into what we're wrapping up over the next couple of months that'll be part of these upcoming webinars. So our clinical surveillance technology is something that we've already that we've created to roll out our critical care offering, and we'll continue to show you some more of that. It allows our providers to be able to, it's an embedded clinical dashboard that connects to the EMR labs and vital systems and really provides a patient monitoring capability to let you know when patients are in or out of range. And then it's integrated with our solution to allow you to make that seamless connection to the location where you want to see that patient. We talked about the InTouch Lite 4. You're going to see more capabilities about that as we release them. Things like the thermal camera that I sort of teased at today and other capabilities that as we're continuing to roll that out. But the Lite 4, available for sale today, no challenges there. But just like everything, we're continuing to improve and add on more capabilities. Consult request is a capability that we've begun to roll out for use cases like employer clinic, kiosk, direct-to-consumer, direct-to-patient specialty. We'll have a full go-to-market release for that in Q4. And this is really a lot of the capabilities you're starting to see today as far as accessing remote providers via appropriate virtual waiting room queues for on-demand in non-acute cases. So for these non-acute cases where you want to say, hey, I really need a provider to come in, I can click something on the screen of the device or through a web app, say, I'm ready, I want my provider to show up, send that request out, and the provider will get alerted. It's another great thing that we're bringing around that sort of is coupled with that through the intake process is intelligent matching, really a matching engine to align between patient-provider availability, depending on clinical use cases, urgency, et cetera. So you'll see more about that from us in the future. Other programs that are on the horizon, things like Friends and Family, to be able to bring in non-registered users for on-demand consults when a family member or when you might want to visit a family member or having a second opinion. Our remote patient monitoring solution, which is working with our Vivify partnership, it's embedded within that. It's really integrating our two solutions together. Our group consults are now rolling out, and that's where you can really schedule group consults with multiple patients and providers. And then we talked about our provider-to-provider connectivity today. And then as our part of our core InTouch operating system, we're adding a lot of robustness and underlying capabilities that really support integration through Active Directory integrations, improvements on our single sign-on that you've seen. We'll continue to bring more and more of that. We talked about the language localization, the CSV data downloads for our web providers, and then also we're continuing to build out improvements in our APIs. Particularly, we've created some great advancements around our Epic and Athena Health capabilities, really laying the foundation and giving us more and more expertise in these areas to allow you to move forward with that. So now I want to just ask another poll question so we can get your feedback initially on what future software updates from the roadmap are you most excited about. So go ahead and feel free to take a minute, whether it's the clinical surveillance, it's our Lite 4 that's just been released, our consult request, our intelligent matching, Friends and Family. Maybe it's Vivify integration or group consults, our new provider-to-provider capabilities, or all the great stuff we're doing around our InTouch operating system. Let's see what people are thinking. So now we're just going to go right into a question and answer session, and we'll go through Q&A and see if anybody has any questions.
Yeah, so now as we enter this Q&A session, please make sure you get your questions in through that Q&A widget located on your console. We'll give a couple minutes for folks to get those questions in now. And as we're waiting for those to come in, just a reminder that on your audience console is a resources widget where we've included the slides from this presentation along with the video clips that Andre presented, and the release notes that were sent out via email. So feel free to download those assets and save them, review them, and familiarize yourself with these new software updates.
Okay, well, since we don't have any questions come in, I'll take it that means we did a really thorough job. No, I do want to say that the things that you've seen today are really, we have a lot of flexibility around these offerings, both from a workflow perspective and from a business model perspective. So whatever you're interested in, feel free to hesitate, or don't hesitate, and feel free to reach out to us to learn more to your main contacts, and we're happy to go in deeper on all of these and show you how it can work for what you want to do at your institution. So with that, we'll just want to say thank you.
Actually, looks like we got one question in. Will the direct-to-consumer have the ability to plug into the back end of an enterprise app?
Will the DTC have the ability to plug into the back end of an enterprise app? I don't. Unfortunately, I don't know exactly what you mean by an enterprise app, but I think if I'm reading it correctly, I think you mean an enterprise application that you're running on, across your health information system. And if that's the case, then yes, our D2C solution is completely API based. We use microservices, APIs, and SDKs to allow us to integrate with all of those solutions. Now, depending on which types of solutions those are that you're thinking about, we'd investigate further and let you know if we've already done those types of integrations, or if that's something that we'd need to put on the roadmap to work toward. But we'd love to talk to you about what you're thinking.
All right, doesn't look like there's any other questions. So we want to give a big thank you to Andre for today's presentation. If you do have any questions or would like more information, feel free to contact us at either of the email addresses on this screen, feedback@intouchhealth.com, or reach out to Andre directly at Grujovski@intouchhealth.com. With that concludes our webinar. Thank you all for joining, and have a wonderful day.